Hey there. We need to talk about the elephant in the room, health insurance and health care, and how much it costs and what you're getting for that money. You know that I helped produce a documentary. It's not personal, it's just healthcare. And I have a book also. If you'd like a copy, let me know and I'll be glad to get you one. Well, I want to talk today about the 3 takeaways from this book. Number 1, the system is designed to work against you. It works for every vendor except you, the employer, the person paying the bill. It is now your fiduciary obligation to ensure the cost of healthcare for your employees is reasonable. Fail to do so, and you're opening yourself up to lawsuits. You heard that right. Growing wave of class action lawsuits that being filed by employees against employers for breaching this fiduciary obligation. Don't get caught. In the book, you'll learn the things that you need to do to prevent that from happening to you. Takeaway number 2, you have more control than you think you do. I know, but Allison, we can't control health insurance costs. Well, it isn't exactly true. You absolutely can control those costs, but first you need to understand how the system works against you. There's a story in the book about an MRI, and I expect you might have heard something similar from your employees or your team or a colleague or somebody you know. Patient was billed $4,900 for a standard non-emergency based MRI. That same procedure could be delivered down the street, literally down the street, for $500. That's not an anomaly. It's the norm. And it's happening because the system lacks transparency and accountability. Here's the good news. Once you understand the game, you can start playing it to your advantage. There are several strategies you can use to take back control. Number 3, quality care often costs less. This is so hard for people to digest, and I understand it. Nobody wants cheap or crappy healthcare. Nobody. Not you, not me, not the mother of a child, not the spouse, not the person who's getting the care. Nobody wants crappy healthcare. In healthcare, there is almost always an inverse relationship between cost and quality, right? So the trick is, how do you find high quality care delivered at a fair price? The dirty secret here is that the fee-for-service model incentivizes quantity over quality. Providers are paid for each service they perform, not for keeping people healthy. This leads to overutilization, higher costs, and not necessarily improving outcome. The solution to that is value-based care. What is that? Well, there's a whole host of definitions for value-based care. High quality, low cost. Well, how are you determining that? Bundled pricing, subscription models. It's a whole series. So figure out what works for you. We can help with that, by the way, and align the services you offer to your culture and the needs of your employees. So if you're ready to dive deeper, reach out. We'll get you a copy of that book. You can watch a copy of that movie, or you can schedule some time with us.